Hey, hi, welcome everyone. Thank you so much for coming. So Margaret Mead said, never doubt the ability of a group of thoughtful, committed community that can change the world, for that is the only way it has ever happened. And Safe Paths is all about that. But that requires commitment, action, and change. Today, through our implementation and rollout team, you will hear from us about how Safe Paths is bringing contact tracing to your community and public health, raising awareness and understanding on it. The question we will also explore today is there a way to intentionally design an intelligent system of contact tracing with human centricity and privacy at heart?
Professor Ramesh Raskar will first present, and then we'll introduce to you 3 members of the Safe Paths implementation team.
Hello, everyone. This is Ramesh Raskar, Associate Professor at MIT Media Lab and leading the Safe Paths initiative. And let's talk about contact tracing as well as reopening businesses with COVID Safe Paths while preserving privacy. So now digital contact tracing is about using a smartphone, especially GPS and Bluetooth for proximity, notifying if you have crossed path and providing location and context of that encounter, and also providing abilities for public health and businesses to have coordination tools to respond to them. SafePaths platform is made up of 2 main pieces, the SafePaths app, as well as the SafePaths dashboard for public health and businesses. The app is about exposure notification, access to resources, and very soon with our partners, other features like symptom tracking, quarantine verification, and other certificates. And the dashboard is for public health and businesses for coordination, for tracing conversations, as well as very soon you will see predicting hotspots or spread prediction, or coordinating either people who are isolated or infected at home, or for businesses to deal with employees or schools to deal with the students. For all of this, we want to use proximity technology APIs, such as telecom or GPS or Bluetooth, including the Apple and Google exposure notification APIs, Wi-Fi, and others. And all of this would have been easy to build, but the key here is we want to do this while preserving privacy. And privacy is not just for an individual, it's also about consent. It's about trade secrets between different organizations. It's about being consistent with regulations. And often it's also about national secrets. And at the same time, how do we make sure that there's enough incentives for healthy people to participate? So by privacy, really we mean all these 5 things. And Safe Paths is really made up of 3 different pillars. In technology, we of course have our flagship app and web tool. At the same time, we are not here to compete with other software solutions. We are here to create a very large, one of the largest open source code base that you can use, and many people are contributing to it, provide SDKs and APIs so everybody else can also build their apps. Everybody else can also build their special solutions, because health is a very regional topic. And also provide very algorithms that are suited for COVID-19, that maintain privacy, that scale, software engineering principles, and to make sure it's almost like National Weather Service. It doesn't matter which app you use to check for upcoming challenges with the weather. We want to create this interoperable backbone. So it doesn't matter which app you use and which language from which country, you'll still be able to figure out exposure and other challenges with respect to COVID-19. And with Think Tank, because of the interoperability, we are providing privacy and ethics guidelines. We convince stakeholders. We also write papers about landscape. What are other solutions that are out there? Where does Safe Paths fit? But if you choose, there are other solutions out there as well, and many publications. And then we have a very large implementation arm that works with public health, provides training and monitoring resources for them. And as I will talk a little bit later, a lot of solution providers and solution seekers, innovators and entrepreneurs are contacting us. So we're providing a platform for them as well. So we're very proud of the Safe Paths Alliance that made up of many members of MIT, but the work is also shaped by many conversations with WHO and HHS and CDC and Mayo Clinic. And also we have our partner nonprofit now, PathCheck, that provides many of these implementation rollouts. So in that sense, SafePass is really creating solutions for governments to manage selective lockdowns, for public health to monitor COVID individuals, for workers to get sick leaves approved, for schools to manage entrances for attending classes or monitor COVID plus students who might be staying in their dorms, and so on. So this is what SafePass wants to provide. Again, this should be a straightforward implementation by a large company, but the key is how do we make it privacy preserving at the top and also interoperable at the bottom. So the flow for an individual might look very different. Contact exposure notification is a small, important piece of it. Nevertheless, even contact tracing is still a tiny piece of the puzzle. And what we need to do is provide all these other layers. And as you'll hear from the implementation team later on, this is what SafePass is trying to do. And then the experience flow for businesses is also very different compared to what it would be for an individual. And again, SafePass is here to provide the privacy layer as well as the interoperability layer. And many solution providers are contacting us with solutions you may have. You may have, an identity, privacy identity system. You might have an open ledger or new type of a CRM or a system that can detect proximity by using QR codes. We want all of you to send us a one-page summary and 1 to 6 slide deck. And we have a rolling deadline every Tuesday at 5 p.m. So send us your material because we can connect with you with solution seekers who are also approaching us, some of them Fortune 500 companies who want to reopen and operate safely. And so if you are a large organizations seeking solutions, please pose your challenge. Tell us if you want us to be your pilot's partner and contribute expertise. At the same time, many foundations and venture funds are also approaching us looking for the right ways to engage. So if you are a solution funder, we want you to be part of this as well. And very soon we'll announce an ideation workshop that brings together the solution providers who are usually innovators or entrepreneurs or startups, solution seekers, which are usually large companies, and solution funders as well. But remember to send us your one-page summary and 1 to 6 slide deck, and the link is available on covidsafepaths.org. Let me briefly talk about a fantastic new algorithm that we have published this week. Some of you are familiar with Google and Apple Proximity API, where two phones would talk to each other over the Bluetooth channel and exchange keys. And an infected person will upload their keys to the server, and then all the healthy people would download that key to see if the downloaded key is the same as the key they heard over the Bluetooth channel. And that would close a loop. And then the exposed person would get to know about this in a privacy preserving way. And we have talked about in the past that if you use a Bluetooth only solution, although it has the best proximity indicator, it has challenges with respect to adoption versus effectiveness. It has challenges with respect to fomites, which is infection spread from surfaces. It has challenges about inclusivity, users who don't have smartphones, and other issues with false positives and false negatives. But GPS has its own benefits and challenges as well. It provides great privacy, adoption scales very linearly, but accuracy is not as good, right? But it does provide something very important, which is location and context. And in fact, what we think that if you don't provide this location context in contact tracing, then the trust in the system could be very low, because if individuals start getting alerts saying you have been exposed, you have been exposed, you have been exposed, but they don't understand the context, that actually create a lot of problems. And if they get an alert for you're exposed, but not whether you are in a grocery store or when you're at a social event, that could also be confusing, because maybe in the grocery store, you're wearing a mask and maintaining a social distance, but at the social event, you're shaking hands and not wearing a mask, right? And also it could create a lot of societal challenges, because without context, certain individuals could start kind of reverse engineering this algorithm and start blaming people they like to blame, usually minorities and the underserved population. So we want to prevent this problem of civil unrest that we have already seen in other parts of the world. And again, public health requires more than contact tracing. When you talk to somebody who says, I think I might have been exposed because the phone is telling me, they just need to interview this person and say, where were you? What were you doing at that point? Were you actually shaking hands? Or were you in close proximity? with this person? Were you wearing a mask? Do you live in the same house? And so on. So they need that context to do anything useful at all with this exposure notification. So what we have done is published a new work that actually combines Bluetooth and GPS. And the idea is that if you want to come up with a technique that primarily relies on Bluetooth for proximity, and we still need GPS for location, but not for proximity, there are two options. Option one is you can continue to use GPS APIs that we provide as they are in SafePaths. But option two, which is a new option, is that do not log location GPS on your phone at all. That means that even for the healthy person, the GPS is never revealed because no location is logged, but the GPS is revealed only if they're exposed. And the way this is done, and also the GPS of the infected person is never revealed to anybody, even to the infected person or to health authorities or to a central server. Again, GPS is never revealed for an infected person. And the way this problem is solved is that the GPS of an infected person is encrypted and transmitted over the Bluetooth channel to the healthy person. And by doing that, none of the three entities can actually know about the GPS location ever. There's no GPS location logging as such, and it's decrypted only when the same daily keys that you know from Google Apple APIs are received by the healthy person. So to summarize, GPS is used only for context, not for logging in this particular algorithm. And the GPS is never revealed for an infected person or a healthy person. It's never shared with the health authorities, and is decrypted only by getting that signal over the Bluetooth channel. So look at our paper that's been out this week, and it could be an intermediate solution for those of you who don't want to log GPS location. I think it's a big religious debate about which approach is better. At SafePaths, our goal is to provide all these solutions. So depending on your jurisdiction and what you want to do, one of these three solutions could be the right solution for you.
Thank you.
And if you are considering as a public health entity or a business, we definitely expect you to build a solution that's privacy first, but also using open source that will avoid a vendor lock. It's interoperable, supports multiple languages, supports users who may not be carrying a smartphone. More than 50% of over 65 population in the US do not carry a smartphone. And they're the most vulnerable right now. And it works as a dashboard, not just an exposure notification. It's modular and easy to use. Thank you.
Thank you, Ramesh, for this presentation and explaining about how the exposure notification is not the only thing that we need to help public health as well as restarting the economy. We would still like to introduce you a little bit more to our audience. You need no introduction, but Professor Ramesh Raskar is at MIT Media Labs, and he's also leading the SafePaths initiative. He has been an inventor of a camera to see around corners, for which he received 2016 Levelson MIT Prize. He holds 90 plus US patents, has co-authored books including spatial augmented reality, computational photography, and 3D imaging. He has also appeared in NY Times, CNN, BBC, and several technology news websites. And he has worked on special research projects at Google, X, Facebook, and Apple. And we would also like you guys, we are very happy that you guys are here, and we would like that you put your questions today that you have regarding this presentation, also going forward when we will have a roundtable after that, put your questions in the Zoom Q&A feature. And also there is a chat feature which you can use to say hello to us or any other things that you would like to talk to us about. And now I will let Rachel introduce our roundtable.
Thanks, Deepti. We have an amazing team here at SafePaths, and one of my favorite parts about being a volunteer here is the amazing people and the talented people that I've gotten to meet and work with. So I am very excited this afternoon to introduce to you three of our volunteers. We have Khalil, Sienna, and Francesco on the line here, and they are part of our implementation team. Now, I'll let you each introduce yourselves, and so if you could tell us about yourself, and then also share with us a little bit about why you got involved with SafePaths and what makes you volunteer with this project.
Yeah, thank you. Hey guys, it's so nice to be part of this Zoom webinar today. So my name is Khalil. I'm a graduate student and researcher here in Cambridge at MIT and Harvard. And for the last 7 weeks or so, I've been involved in this incredible project. My background is in international development and policy with specific focus on global poverty and economic development. And so, health is such an important variable in the success function or productivity function of any country. And if you have healthy citizens, it means that they can be productive, and productive people can make money. And so if people don't have an income, it leads to all of those other issues, including poverty, right? Which is something that we want to avoid. So, in this pandemic, I think having a solution that helps health workers do their jobs more efficiently is something I really wanted to support. And so as we expand our efforts around the world, I thought that my background in development and working in countries outside of the US would be useful. And so far it has been. And it's been so wonderful being joined by, Francesco and Sienna and our implementation crew, because we've become really close over the last few weeks, and we have a good time working with governments and health officials around the world and learning through each other and being able to support each other.
You have a great team. So thank you for sharing with us, Khalil. And Sienna, would you introduce yourself?
Sure, absolutely. Thank you, Rachel. I have to start with, it really is about the people and the work that we're doing here. Khalil introduced me to the project, I think on day 3, which puts me just at week 8. What has been really an incredible experience and an opportunity for those of us that are graduate students to put into practice and play what we are passionate about and what we study on a daily basis in the classroom. I knew of Ramesh from a lot of my classmates at Harvard. I'm also a graduate student there, about to graduate in 26 days. And this was just an incredible opportunity for us to work with him, really share the vision of what we see on the face of this crisis. My personal focus was in, ironically, crisis management, but looking at it from the perspective of economic development and policy. And so very engaged and very focused on how do we work with governmental leaders, private sector leaders, and helping them to adopt comprehensive solutions that highlight the best of technology, like what we have here, in order to really do the best for their individual communities. What Ramesh said is really important in the sense that the work we do is customized. And so my own background was in education, working with jurisdictions throughout the United States, which I'm doing now. And so we've been able to use that knowledge because each region, each city, each county is very distinct. And so how do we customize what we're doing to those needs? And that's been fun so far.
And that's one of the things I'm hoping you'll tell us a little bit more about, is that customization. But first, last but not least, Francesco, could you introduce yourself?
Absolutely. Thank you, Rachel, and welcome everybody. As everybody said here, like, this team is amazing, and it's all about the energy that we were able to create, and the atmosphere is just something great, and I'm very happy to be proud of this. And I just wanted to say, so I'm a postdoctoral associate at MIT. I'm a chemical engineer by training, and I work on sustainable technologies to impact climate change in a positive way. So I work on sustainability, carbon capture, etc. And I got involved in SafePaths because Ramesh has been one of the most active mentors of an initiative that I started on campus called FAIL, Inspiring Resilience, that is about bringing psychological safety, and it's about bringing, decrease the stigma on vulnerabilities and failure, and eventually enhance well-being in hyper-competitive environment and decrease mental health. So it's such an amazing project. And why I joined is because when SafePath started, Italy was basically the country that was suffering the most in all this. And I felt I wanted to do something. I wanted to actively participate to help my family, which, by the way, is here to ciao mamma, ciao babba. And yes, to really help from abroad and really contribute to this, even if I was not there. So for me, it was such a great occasion to contribute. And thank you so much for welcoming me. And it's just great.
Thank you. Now, Ramesh, Khalil, Sienna, Francesco, I know you guys are on the phone with each other for hours every day, so I am hoping that you will talk amongst yourselves And I wondered if you could start by telling us a little bit more about what a successful implementation looks like for you.
Yeah, so the definition of success changes by jurisdiction, and it's actually one of the challenges that we come across almost daily. A solution that we may have spent a significant amount of time crafting and presenting to one context, you go one state over or one country over, and it doesn't work, right? But that's part of the process of development and working around the world. We need to come up with solutions, think through what I call implementations in hard places, right? We need to, assess, economic conditions, the political atmosphere, the strength of institutions. So, to come up with a solution in collaboration with the health authorities or the local government, for something that makes sense specifically for them. So that changes, right, from one to the next. What's interesting is the approaches that we have to take. Sometimes it's top down, where we work with the government and then they use their office to make an announcement to the citizens. Sometimes it's bottom up, depending on the strength of trust in that particular location. And then we'll engage, local community groups. We'll get them to champion us in their communities, and that forces their government to come on and have a conversation with us. And then in other instances, it's a hybrid process. So we approach the government or health authority and they say, let's talk to our citizens and see what they think about this solution. And if it's something that they want, then we could go and push through and support you in this effort. So there are different approaches that we have to take. The needs are different. It changes from one to the next and every day, and sometimes multiple times in a day. So that's part of the implementation process, but also the needs are very different, right? And so, especially in the last few weeks, we've been spending a significant amount of time trying to understand better what the local conditions are in some of the lower capacity countries where they do not have the tech infrastructure to drive adoption of our solution. And so we have to think a bit critically about, well, we can't just leave them behind, right? We're offering a solution that everyone can benefit from. So how are we going to think about this really unique, challenging problem? And what are the solutions we could come up with? And it's exciting. It's an exciting opportunity because I know we as grad students, we like to think through some of those challenging problems. So we have come up with some solutions, and we're hoping to implement or to add them as part of our solution to fit the needs of those low capacity contexts. But also interestingly, how some of the situations on the ground in, say, Africa is quite similar to some of the Latin America countries that we're working with, or some of the Caribbean. So there are parallels, and there are lessons that we're learning from a particular region that we could apply to others. But it changes every day, and success is very, very different from one context to the next.
Yes.
That's exactly right, Khalil. I was going to say, in the US, we have this similar dialogue with the people and jurisdictions that we're speaking to. And it's funny because Khalil, Francesco, and I speak frequently throughout the day, because I think we've been surprised at some of the parallels that we've seen in communities that don't, from the outside, look very similar. So it's these two pieces, really. On one hand, we're bringing together individuals within a government that may have never worked together before, whether it's finance, economic development, public health, education, elected officials, you name it. And so that has been an interesting thing to facilitate and be the gel that brings people that are very focused on a constituency, but different aspects of it. And how do you bring them together for a solution that will allow them to reopen society, which is where all of our conversations are focused right now. We also were looking at, we're coming into summer, and so our discussions have also been very focused on this idea of, what does tourism look like in the face of global pandemic? What does that mean for an airline, an airport, industries, and hospitality? And how do we help them to maneuver this new space? And that has been a conversation that has allowed us not only to bring together the resources that are incredible on our team, but also to bring together jurisdictions that may have never spoken to each other, whether it's Caribbean speaking to a state in the Southeast. What are we thinking about when we look at borders? Again, climate starts to play a role. Francesco, as you mentioned, hurricane season is around the corner. So what does it look like to put together a shelter if your community is going through a peak of the virus? And these are conversations and questions that we get to grapple with on a daily basis. But our jurisdictions are more than that. They become partners. And so they become thought partners and leaders in this space. So we're learning from them. We hope they're learning from us in order to design really amazing solutions. Francesco, I'm sure you have the European perspective as well.
Yes, absolutely. Something that I really wanted to add on top of what you described very well about us collaborating with governments and working with local jurisdictions and all the healthcare facilities and authorities. I think one amazing thing that I see happening everywhere is that we're building also local communities that are exactly like us, that are working on their own app, and they want to use our tool basically to create something more comprehensive to track the virus, but also do other things. So it's not just about tracking the virus, it's about creating a much larger ecosystem. And there's so many local groups that are working together that bring so much energy, and they can really develop their own local solution, because each place is different, as you mentioned, right? So it is very important to create communities through the actions that we're doing everywhere. And in Europe, I think, it's great. Starting from where I'm from, Italy, but all the other countries, there's been so much support, and we felt very welcome in bringing our ideas and brainstorming to also refresh what was the understanding of how should we do this and what are the best practices and best strategies. Just be part of the conversation is amazing. So I think we feel very lucky about that.
Yeah, Francesco, I think, we started this project, this movement, thinking about, implementing just this solution. And very quickly we learned that we had to put on our policy hats, we had to put on our politics hat, we had to put on our development hat, because it's going back to the idea of a productivity function for context, for country, right? It's such a broad conversation that goes outside of just a solution to contain the spread of a virus. We're thinking about the economies, we're thinking about tourism, we're thinking about travel, we're thinking about getting people back to work, right? And so we have to come up with all of these, frameworks for each of those, which is so incredible, but also thinking how it plays into the broader region that they're, sitting in geographically. And so how do we ensure that people can move across borders, across boundaries freely in a way that all of those technologies could communicate with each other and, generally maximize the utilities of people. So these are some of the conversations that goes on almost every single day in every implementation that we're doing.
Absolutely. Well, sorry, just one thing that I wanted to add on top of that.
Go ahead, Francesco.
Is that we're really trying to guarantee that all countries can talk to one another. So interoperability, it's a big work that we're trying to do. Because in a way, what I always say, we don't want to build invisible walls between countries. Everybody needs to feel safe to travel and go everywhere, so that we're all connected and we're all together on this and not divided because each country is adopting a different solution, right? That doesn't talk to another one. So like, this is also our point, like being the glue among all the possible solutions around the world. Please, Sienna, sorry.
No, it's fine. And there's so many layers to this. I was going to say, in response to Khalil, what you were saying, what makes this fascinating, honestly, is every day we get a new piece of information, whether it's from the technology side, whether it's data that has come out about a certain demographic group. Ramesh, you mentioned even, like minorities and groups that are, disadvantaged socioeconomically, how this is impacting them, what that means if we're walking into a summer, you have people sequestered at home and they don't have air conditioning, for example. And these are challenges that are coming up on a daily basis as we all start to get more organized from the government perspective, private sector, et cetera. And then Francesco, when it comes to tourism and when it comes to borders, I also think it's interesting because our conversations, especially Khalil, I think we think of the Caribbean specifically, is this idea of you are focused on two populations. And one side of that population is your local population. Is how do you protect the people that work in your hotels, airports, again, that make up kind of the fabric of day-to-day life and what your country is. But then you also want to become a safe destination for those that are looking to escape and for vacation. And so how do you bring those two issues or populations together in the face of crisis? And so where pandemic is interesting to me is any crisis is going to exacerbate issues that existed before in society. We see this especially in hurricanes, again, in the Caribbean, whether it was, economic problems, policy problems, those all come to the surface in a crisis. And so we are seeing that in this sort of slow roll crisis, we'll call it, with pandemic, of how these issues continue to brew. And so this is really about good use of technology in order to help us confront these issues and do good work on behalf of people.
Thank you.
I actually just wanted to say one thing. You might hear Caribbean come up a lot, but that's because, slight bias, I'm from St. Lucia, so Caribbean boy here. But also, as we think through all of these challenges, we do have a lot of fun working through it. So we talk a lot, I knew Sienna for a while over the last year, just from our interactions at school, but Francesco, I've gotten to know very closely over the last couple of weeks, and we spend a lot of time talking to each other and having fun. So I just wanted to highlight that. It is serious work, but we are having fun.
Absolutely. We brought together the divide that's existed, I think, since inception of MIT and Harvard. And so I think, Ramesh, you facilitated kind of the ultimate collaboration between these two, small schools on the Charles River.
Thank you, guys. Thank you. I mean, we see the spirit between you guys, what you are achieving in implementation team as well. And it's really nice to see how you're working for the communities. One question that we would also, or maybe our audience would also be interested in knowing, is that our brand is privacy preserving, right? And how do you see that the local public health is headed with respect to both contact tracing initiatives, as well as, health inequities you talked about a little bit, but how they are taking the privacy preserving part of contact tracing? And this is really the last question, then we would like to move to the Q&A. So whoever would like to answer that.
Deepti, that's something we could probably talk about all day for each of our different areas of the globe that we're focused on. Obviously, in the United States, privacy first is of utmost important. I will say, when we had our initial conversation 6 weeks ago, 7 weeks ago, when everybody was getting ramped up and organized with their individual kind of state task forces, teams, et cetera, that was the number one question that we would receive. Our commitment to privacy as a project, I think, is the tenet that holds us together. That we're not willing to compromise that, and that commitment is what comes through in our conversations. Our work is not limited to implementation of a tool, as we've heard us say for the last 20 minutes. It really is about public information as well, and that's what you're starting to see in the press. There's articles again each day this past week about privacy and questions about the use of tools like this, and we've seen in 2 months both bad use and good use when it comes to human rights and protection of privacy. And so that is a conversation we absolutely initiate, but we want to make sure that's at the forefront, even when it's something maybe a jurisdiction has not thought about. I know Khalil and Francesco, you've had some very interesting conversations in this regard as global gets into kind of a more diverse set of standards. I'm sure you can speak to that a little bit more.
Yeah, so we've had some very interesting situations over the last couple of weeks, but you're absolutely right. So privacy is something that we're obviously focused on, and it's one of the first questions that we get, whether it's from the health authorities or the government, or even the people, the users that we expect to download our app. They want to know how we're safeguarding their information, who has access to it, how it's being stored. And so I'm always happy to be able to tell them, well, actually, you're in total control of this. We decide to share with who, and everything else happens in the cell phone, and it's not going anywhere, right? So your location data is stored in your cell phone. There's no mandate that you share it with anyone that you don't want to. They shouldn't have access to it if you wouldn't like them to. So those are some of the things that we talk about. But also we've had those curious cases where some locations may have adopted our solution, and maybe privacy isn't first and foremost for them. But what's great is we've been able to actively engage them and bring them into our conversation and explain to them exactly why we need to think about privacy. In some countries, they launched their own solutions, but they had low take-up precisely because of this. And we see almost in maybe 2 or 3 cases where countries launch their own apps, they're now coming to us for help, right, in that effort, which is we want a solution that is privacy preserving, that is able to protect the civil liberties of their citizens, and to help them frame this in a way that we can present to their citizens to encourage uptake.
Thank you. And Ramesh, would you like to have any last thoughts on implementation before we move on to the Q&A?
You're muted, Ramesh.
This conversation is a great example of why when we try to solve societal problems, even techies like ours should not be, the ones kind of setting the agenda. And I just have tears in my eyes listening to all these stories, because this is what really matters. When we care about solving a problem, it's not just about technology. It's about understanding what the problems are, understanding what the complications are. And as Khalil and Sienna and Francesco have reminded again and again and again, that engagement should not be discounted ever. And often the engagement does not go right in the first round, but after iterations. And this is what our implementation team and everybody on this call does, which is stay engaged, learn, and have the humility. Please have the humility to understand that what we're doing may or may not actually solve the problem. In fact, in some cases actually can make the things worse. And we have to learn from the people who are on the ground and come back to the drawing board and restart sometimes or modify what we are doing. And this is what really makes it totally worth it. I mean, as Khalil said, I think it's so energizing, it's so dynamic, but also makes us very humble.
Yeah, I also just want to add, Ramesh, we're also learning so much about technology, right? For those of us who aren't coming from a tech background.
Absolutely.
I think I've learned all of the lingo from the tech team and the devs. So,
I want a degree.
Okay, I'm going to, my next semester at MIT, I'm going to teach a course on how to deal with epidemics. And I want all of you to give a guest lecture.
Yes.
Done.
Great. Sign us up.
Well, thank you. Thank you guys for being here and for talking with us. And now I'm going to pass things over to Deepti to move us ahead.
Thank you, Rachel.
Thank you so much, guys. I mean, I echo the thoughts that Ramesh and everybody else here shared, that really it's the passion that is bringing this community forward, as you can see it here. And it's like brilliant minds that are shaping it, and it's technology, it's community, it's need for really something that is related to public health as well. And we are really wanting to create a community here that works together to solve the problems of the future, as well as the current crisis, obviously, I mean, absolutely. With that note, we should now go to the Q&A session, where we request you to put your questions in the Q&A feature, which is right there at the bottom of your screens. And I would let Rachel take the first question, and then we'll answer whatever questions you have. Okay, let me just go with the first question myself. So Stephanie asks, how does SafePaths help people in the public health domain that do not have smartphones? How does it help infected users who do not have, who do not have a smartphone? I think Sienna did touch about this topic a little bit, but if she wants to elaborate on that a little bit again, that would be great.
No, so this is a perfect example of when we talk about implementations in hard places. We have some countries where there's a very low penetration of smartphones, and we cannot just leave them behind. We have to come up with solutions for them. And so we have two solutions that we're currently working to introduce into ours. One is a manual way for contact tracing, right? And so the patient who tested positively for COVID-19 would sit with the contact tracer, and they would tell them all of the locations that they've been to and the times. And the contact tracer can manually put that into the GPS map, right? And create the JSON file that is used for our solution, at least, to be able to send out notifications. So that's one solution. And the second is with one of our partners coming out of Africa. Because we are collaborative and open source, we have all of these additional groups coming in. We have a QR code system where users have a digital wallet with a QR code, or it can be printed as well. And as they go into public spaces, that code is scanned, and so you're getting a map of all of the public locations that they've been to. And from there, we're also able to know exactly where they've been to and put that into our Safe Places tool, and we can use it to send out notifications as well.
Yeah, this is a very important point about Safe Places, that it can be it could be a situation where nobody, just as a thought experiment, even if nobody in town has a smartphone, Safe Places as a tool can still help because it can create, it's very much like the National Weather Service. You don't need to have a smartphone to check weather. You can just check the weather on TV or newspapers. And we want to create, if there's a storm coming, everybody knows through TV or newspaper. And we want to do the similar sick weather about infected people through these channels of safe places. And that output can go to the same places, such as news channels, newspapers, and so on, to publish information about where the hotspots are.
And our next question is one that I know you all receive quite frequently, and it comes from Tim. Which jurisdictions are involved with Safe Paths, and how many people are using Safe Paths?
Privacy guidelines. Because our privacy guidelines, we don't keep track of the user activities, but we have lots of downloads, and we have partners who are building their own versions. So we'll have more information about that. Even at the end of the day, our goal is not to build one app that's a dominant app. We are not here to dominate, we are here to collaborate. So we want everybody else to use our source code, use our interoperable backbone, use our platform to connect with each other. We will definitely continue to push our flagship app, but we want everybody else to use our code. There have been over 300 forks on GitHub for the Safe Paths code base. So dozens of people out there are playing with Safe Paths code and building their own solutions. And we get emails literally every day from somebody saying, hey, we want to partner with you. There are two ways you can partner with us. You can either join forces with us and help us think through and build a new feature. Maybe you want to build a future feature with QR code. You want to build a feature with identity, or you want to do maybe ultrasound. I don't know. People are adding all kinds of new ways to do that. Or you can take our code and do whatever you want with it. They'll be happy as long as you save the world in some other way.
Absolutely, and we work with jurisdictions to really work through that decision, depending on who's approached us and who we're speaking to. But it's allowed for some really creative interpretations and ways that I think have enhanced our personal development of the tool.
Yeah, I also want to, since I've seen people, participants in this call that are helping us locally, to acknowledge all of them for all their help and their energy in helping us, developing apps and, the code and the solutions at local level. Thank you so much for being here today with us as well.
Yeah, and then it's so helpful to have all the different groups approaches for partnerships. They're coming up with solutions that even we didn't think about, right? And they have all of these creative ideas and they have the ability to develop them. And so we're happy to say, yes, let's help you with some of the resources that we have and help you, introduce some of those additional features that you're thinking about developing into a solution that, if it makes sense for your country, your community, we're happy to do that.
All right, thank you so much, guys. So Ramesh, I think this next question is something that you're going to love, because this is the topic that we've been talking about a lot and also we've written a lot of articles about. It'll also give a little bit of explanation about Safe Paths to our audience. The question is from John, who says, given Apple's recent commitment to Bluetooth-only approach with Google, is there any concern that Apple would not allow an app that uses the elegant hybrid solution, GPS plus Bluetooth, that was just described? Would you like me to repeat the question?
Ramesh, you're muted.
This is an excellent question, and there's a lot of confusion about what exactly Apple and Google will allow as coexisting APIs if you're using the so-called GAN, G-A-E-N, Google Apple Exposure Notification protocols. And so we'll, that picture will be clear, but countries like France are really pushing back, saying they would like to release their own apps with additional functionality. So you'll hear more from us as we write more documents about it and so on. But being MIT and being part of Safe Paths, we are not kind of sitting still, and we have provided even more intellectual horsepower for everybody to kind of think about it. So the new paper that just came out is actually consistent with the Google Apple philosophy, because we believe these are benevolent companies that are trying to do the best and most privacy-aware solutions. At the same time, public health requires the location context as well. And so as we have it on the slide right now, we can indeed create solutions that use Bluetooth for proximity and GPS for location, and still use this ability to expose GPS only if you're exposed and there's no explicit GPS logging, location logging on your phone in the option 2 here. But we continue to believe that option 1, where the GPS stays completely on your phone and it's a private diary, is also a great solution. So I think we'll see how this progresses, whether we go for option 1 or option 2. From SafePaths, we'll continue to support all these features. So at compile time, when you build your own app or we build our app, we can pick at compile time any one of these options.
Thank you. And we have another great question. This one comes from Ram. What are the outreach and training plans for this app, especially with healthcare regulators and patients?
Yeah, so the first few weeks, we were getting a lot of inbound, right? I think a lot of states, a lot of countries were trying to figure out how to navigate their way around this. And so a lot of the initial conversations we're having were coming directly from either health departments or from governments. But that conversation evolved over time, and we're seeing a lot of private entities coming forward saying they'd like to help. So, for implementation, it's really connecting with health departments. I think that's really important because they're the ones doing the contact tracing. They're the ones who are going to be using the Safe Places web tool. And that's what's going to be able to send out notifications to users who have the cell phone. So, the approach is really connecting with health agencies, healthcare providers, and people who will be using the Safe Places tool.
Absolutely. And I just want to also mention that for every implementation, we essentially do an evaluation of what the existing workflow looks like. And so obviously a conversation that we've had in the last week looks very different than 6 weeks ago in terms of every place has further developed what their own response has been to COVID-19. And so once we have that analysis of the first piece, that's when we bring in all the pieces that Khalil just described to train, whether it's contact tracers, public health professionals, we're even getting into more, work with independent medical practitioners as well. And so the breadth of that really depends on the need of the jurisdiction. Information and communication to users is also something that we're very interested in. We have at this point alliances with local organizations, youth organizations that want to get involved. And so this for us is the best way to really expand our work, is to be able to create partnerships in that sense, as Ramesh described, to be able to really ensure that our solution, while based in Boston, Cambridge, is one that reflects the local community customs and standards that represent each place.
Yeah, so, as Sienna said, it's no one broad stroke fits all. We have to work with the teams from each community to really come up with a solution that works for them. In terms of training, we do have materials complete with voiceovers and very pretty pictures to take the people who will be using our solution through these abilities. So how to work the Safe Places tool, how to interact with the patients as they come in. We do have training materials for all of those.
Thank you all for your answers, and thank you everyone who submitted questions today. We have a long list that we were not able to answer yet, so we hope you will keep checking in with us on our website at covidsafepaths.org or on your favorite social media. We are going to take the questions that you've asked us and use those to update our FAQs and also to plan future webinars. So we really appreciate you asking the many questions that you have. And now I'm going to pass things over here to Deepti.
Yes, thank you, Rachel. But I think we should also maybe have some remarks from Greg if he's on the call, and have a closing statement from him if he's here.
Greg is not on the call.
All right. Okay, fine. So I would say it was a lovely session, as you could see, and you could see the spirit of all the people who are working with us. At the same time, we would also want to introduce you certain people who are working backstage with us. We would like them also to introduce themselves. Rachel herself, please introduce yourself as well as I would do the closing after this. Kristen, would you like to start?
I would love to start. Hi, hello all, I'm Kristen. I am currently one of the coordinators of our communications team. I've been answering a lot of your questions today, and sorry we couldn't get to them all, but we really do mean it. We're going to use this to update the FAQ on our, directly on our website. So thank you so much for reaching out. I'm currently a student over at MIT, and I'm so thankful to be part of this project along with everyone else that you heard from today. And now I'm gonna punt this over to Bryan. Thank you.
Hey everyone, my name is Bryan. I am in the comms team and also help out with some of the legal research at Safe Paths. When I'm not doing that, I'm a fellow in MIT's Connection Science Group under Professor Sandy Pentland, and also work as the editor-in-chief for MIT's Computational Law Report. And with that, I'll hand it, who should I hand it to?
Mahdi or Rob?
Yeah, let's hand it over to Mahdi and then Rob.
Hi everyone, hope you're all doing well. My name is Mahdi. I've been engaging with everyone within the chat section of the webinar. So happy to see everyone could join us from all over the world. I've been contributing, helping the team with product ops, helping solidify how we could all contribute together in the most effective way possible. Happy to be part of this initiative and excited to see how far we could take it.
Rob, would you like to introduce yourself as well?
Welcome everybody, I'm Rob Brink. I'm producing this webinar and we really appreciate you being here.
I have to say it's all Rob's magic that is working right now here, so everybody has to know he's behind the production of this entire webinar. Rachel, I would like you also to introduce yourself a bit.
Thank you. Hello, I'm Rachel Barbar. It has been my pleasure to co-host with Deepti today. My professional background is in healthcare and specifically genetics. And outside of that, I'm the spouse of an MIT student, which is how I first heard about and became involved with Safe Paths. And since we're all working from home, I will mention that I am also mom to 3 little children. So I have been part of the Safe Paths communications team, and I'm a volunteer there, and I really appreciate the time you've spent with us today.
Thank you, Rachel. Thank you, everyone. Also, specifically, thanks to Sienna, Khalil, and Francesco for giving their time to explain about the implementation team today. On closing note, I'll just introduce myself as I'm Deepti Pahwa. I lead the brand messaging and comms team here at Safe Paths. And outside of that, I'm actually living in Switzerland, and I'm an executive innovation and brand strategist, and also doing my executive education and corporate innovation at Stanford University. And we would like to thank you all for tuning in today, as well as my wonderful co-host, Rachel. A big thank you to Ramesh for putting this beautiful initiative together and letting everybody else be a part of this wonderful community. As well as you have probably experienced today that and also in our previous sessions, that Safe Paths is much more than just a movement to bring contact tracing solutions to this community. It is a connection of brilliant minds that has the opportunity for a dialogue, discussion, and permission to be curious and bring forward a solution that is holistic. And we are working towards creating a privacy-preserving tools to beat the virus, the public health crisis, and eventually build resilient societies. Thank you. Bye.
Thank you, Deepti. Thank you, everybody.
Thank you. Bye.
Thank you.
Thank
Have
you.
a great
Bye.
weekend.
Bye. Stay safe.